Hello students, in the last two videos on ulna you saw, in the first video was the site determination and anatomical position. In second video I have shown you about the bony features of the ulna. Today I am going to tell you about the muscle attachment. So in the first part of today I will tell you the muscle attachment, origin and insertion, and in the second part I will tell you the attachment of ligaments on the ulna, and lastly I will tell you about the ossification of the bone. So we begin with this bone. This is an ulna bone. If I hold it in anatomical position, this is the exact anatomical position of ulna. This is the upper end, the lower end with the posteromedially facing the stellate process. You can see this stellate process. It faces posteromedially, the upper end with the anterior notch that is called as the trochlear notch, which articulates with the trochlea of the humerus, and this is the head of the ulna at the lower end, which articulates with that of the radius to form the inferior radioulnar joint. Now just very briefly I will tell you about the borders. This is the anterior border here. You can see this rounded anterior border. This border is the sharp intraosseous border which faces towards the lateral side. So let me draw a line for the median plane. Say for example this line represents the median plane here. So this is the medial side. I will just draw the medial side, and this is the lateral side. So this is the medial and lateral now. Upper and lower end you can easily distinguish. Okay. So this was the anterior border here. This was the lateral border facing towards lateral side, the intraosseous border. At the lower end, this stellate bony process faces posteromedially. It faces postero. And if you will turn the ulna, you can see that this is the posterior border. Thus there are three surfaces which we have already described. This is the anterior surface is here where I am tracing my finger between the anterior border and this lateral intraosseous border, anterior surface. And then here between the anterior and this rounded posterior border, this is the medial surface. Okay, and then if I turn this ulna, then this was the lateral or intraosseous border, and this is the posterior border. So this is the posterior surface. Now I come to the muscular attachment of the upper end. We will see first the upper end. Just maintain the position, anatomical position. If you are having the ulna with you, just try to mark the bones, muscular attachment, origin, insert along with me. Or if you are not having bone, just draw the rough diagram on a plain paper and then you can mark it. Okay. So this is the upper end of the ulna, and it has two processes. This is olecranon and this is coracoid process. Coronoid process. Okay. So this is the coronoid process and this is the olecranon process. Now let us see first the attachment of the articular capsule onto this upper end. Okay. So I will draw the articular capsule with the green color chalk. This is corresponding. The attachment is very close to that of the articular margin towards the beak of the, here I am marking it, and then it goes on to the lateral side from medial. Then this is on the coronoid process, and then you can see here then it reaches right up to on its lateral surface where the radial notch is present. Okay. Ulnar notch of the radius of the ulna. Radial notch is present here. So this is the attachment very close to the margin of the articular surface on olecranon process and onto the coronoid process. Okay, onto the, so this radial notch will not give attachment to this capsule because then it will blend with that of the annular ligament. That I will tell you when I will teach you the the superior radioulnar joint. Now, let us see the olecranon process. The superior surface of the upper surface of the olecranon process, here you can see from this angle. Okay, this is the upper or superior surface, and this large surface, okay, it gives insertion to the muscle called as the triceps. Okay, so this is in its posterior most part. There is the insertion where I am marking it. It is the insertion of the strong tendon of the triceps muscle. Only in its anterior part, okay, this small area is left, and this as I said here, onto the beak like structure here, this is the attachment of articular capsule, and in between the attachment of triceps and that of the articular capsule, there is an bursa is placed. Okay, so bursa is placed between the tendon of the triceps and to the posterior surface of the articular capsule of the elbow joint, right? The anterior surface is articular, and it comes in contact with that of the trochlea of the humerus, right? Let us go to the medial surface. Okay, on the medial surface you will see that there is this will continue. If you will trace the medial surface of olecranon, it will continuous with that of the medial surface of the shaft itself. But here we limit ourselves onto the medial surface of the olecranon process, and here there is the attachment of the two muscles, that is the ulnar head of the flexor carpi ulnar head of the flexor carpi ulnaris, that is origin, and then another origin here, and that is the origin of the flexor digitorum profundus. Okay, a long origin, quite extensive origin of the flexor digitorum profundus I will show you, but this is also taking origin, the uppermost fibers, from the medial aspect of the olecranon process. Let us go to the lateral surface of the olecranon process. Okay, this is the lateral surface of the olecranon process. Right from here, the lateral surface in front of the posterior triangular area gives attachment to a muscle which is attached posterior to this strong crest. Now you can see this crest. This is the supinator crest, and here this is the site where there is the attachment of the muscle, what is called as the anconeus. Okay, so behind this supinator crest, right up to there is an oblique line. There is the attachment of the anconeus. Now on to the posterior surface of olecranon, where you are seeing a clear triangular area. It is subcutaneous in nature, and from sometime a bursa is placed, okay, deep to the skin. Okay, so this were the attachment of the olecranon process. Let us now come to the attachment of this coronoid process. Okay, the superior surface of coronoid process is again articular, and it will articulates with the trochlea of the humerus. Let us come to the anterior surface of the coronoid process, which is quite extensive. That is also, it is triangular in shape. See this anterior surface, rough and triangular, and the lowermost part of this triangular area is especially raised and rough, and this is called as tuberosity. This whole area along with the tuberosity gives insertion to the muscles called as brachialis. So this is the insertion where I am drawing with the chalk. This is the insertion of the brachialis muscle on anterior surface of the coronoid process. Now let us see the lateral surface of this coronoid process, and on the lateral surface, as I said, there will be the radial notch, and in this radial notch will come, which is articular, there will become the disc-shaped structure of the upper end of the radius. Okay, so this will form the superior radio-ulnar joint, and the margin of this radial notch will give attachment to the annular ligament, which will encircle the head of the radius. Okay, now coming to the medial surface, and on the medial surface there is the attachment again of the flexor digitorum profundus, okay, which origin, okay, this is the origin, and that same muscle which was taking origin from medial surface of the olecranon process is continuous down below as the flexor digitorum profundus it is going. Now this muscle, as I said, is very extensive, and I will tell you the attachment on the shaft, okay, of it later. Now just concentrate here only on to the upper end, okay, upper end of this. Now here what you will see in the lateral surface just below the radial notch, there is a very sharp border which I said that it is supinator crest. This very sharp border which is continuous with the posterior margin of this radial notch down below, this will give origin to the supinator muscle. See this sharp margin, okay, just which is continuous with the posterior margin of the radial notch, it will give origin to the supinator muscle. Now this muscle, okay, will go and get attachment onto the posterior, lateral and anterior surface of the radius, which we have learned on the last video, okay. So this is the supinator muscle which is onto the lateral surface of this, okay. So these are the anterior surface, medial surface and the lateral surface. But on the anterior surface, okay, and near its medial margin, see here where was the brachialis which attached, there is a medial margin, raised area. See this raised area, medial margin of the anterior surface, it gives attachment to the three different muscles. This gives attachment to three different muscles, and these are all origin. And this is on the top, this is the flexor digitorum superficialis. This is here at this point. Can you see this? This point, flexor digitorum superficialis. And after flexor digitorum, from below that, it is the ulnar head of the pronator teres, origin. Origin, we have seen the pronator teres attachment onto the radius where maximum convexity was present. This is the ulnar head of the pronator teres, okay. And just below that, there will be the attachment of the ulnar head of flexor pollicis longus, another origin. All three are origin, one after other. The upper one, flexor digitorum superficialis, then ulnar head of pronator teres, and then ulnar head of flexor pollicis longus, which is going to the thumb, okay. So these were the attachment onto the medial margin of the anterior surface of the coronoid process, okay. Now this whole, articular surface notched, that is trochlear notch, okay, this will articulate with the humerus, and onto the side it will articulate with that of the radius, okay. So now we move to the shaft. Let us go to the shaft. Again, just see this anterior border, and this was the lateral border. This is the median plane. So this is the lateral side, okay, that was the lateral side. Now I will tell you the attachment of the anterior surface. There are two muscles which takes origin from anterior surface. One, it is the continuity of the same flexor digitorum profundus. Okay, this was the flexor digitorum profundus. See this. This will come and attach onto the medial surface, and then it will come after medial surface onto the anterior surface below the ulnar tuberosity. So I will just mark it from its upper 2/3 of the anterior surface. Okay, see this muscle, the whole of the anterior surface. It is giving attachment to the flexor digitorum superficial, which will also extend on to the interosseous membrane laterally, because to this sharp margin attaches the interosseous membrane. So this insertion is extending here. Let me tell you, this is also extending onto the medial surface, okay? And then it is taking origin from the anterior surface to the interosseous border of the anterior surface, okay? Now, in its upper 3/4, okay, in the lower 3/4, this muscle, that is the flexor digitorum profundus, is not extending. So this is an extensive origin of the flexor digitorum profundus. Now below this there is an oblique ridge present here, and to this oblique ridge which is present onto the lower end, I hope you can see this oblique ridge. If it is not seen, it's okay. This is the how the origin of the muscle called as pronator quadratus takes place. On the radius we have seen its insertion. This is the linear origin of the pronator quadratus. Okay, this pronator quadratus is attached from medial to the lateral side, the oblique ridge. So this is the pronator quadratus is at. So both the origin are there from the anterior surface. Let's go to the posterior surface. Okay, so I will go to the posterior surface, and you also, if you are having the bone, turn your bone to that of the posterior surface, and there are the one of the muscle we have already covered here, and that was the anconeus, which was continuous with the posterior surface. See here, this extensive muscle was here, the anconeus muscle. So it will be the upper part. There is an oblique ridge which divide this surface into upper and lower part, and then the lower part was once again divided by vertical ridge into the medial and lateral. Towards the interosseous border, it is the lateral surface, and from this lateral surface, okay, there will be the origin of the three muscles. Okay, three muscles will take origin from the lateral surface. Which are these three muscles? Abductor pollicis longus in upper 1/4, after the oblique line here, which divides it into the upper and the lower half. It is the abductor pollicis longus, right? Then there will be a muscle, extensor pollicis longus. I will show you in the atlas this attachment so that it will be clear. But this origin of this muscle is towards the lateral side of this vertical line. And then the lower 1/4 part of this surface gives origin to the third muscle called as extensor indicis. So once again I will tell you, in the lower 1/4 part of this posterior surface is the extensor indicis, in between is the extensor pollicis longus, and in the upper 1/4 it is the abductor pollicis longus. It is abductor pollicis longus muscle is present. So these are the attachment onto the posterior surface. But then there is an important attachment here, okay, and that is onto the posterior border, and that is an aponeurosis is attached onto the posterior border, okay, and this aponeurosis gives attachment, okay, just I will draw with the green color onto the posterior border, the attachment and aponeurosis. Now this aponeurosis for the flexor surface, it will give origin which will wind round its posterior surface, I mean say medial surface to come the flexor side or anterior side, and there is a muscle which is also going into the extensor compartment. Okay, let us see which are these three muscles which are attached not directly to the bone but to that of the aponeurosis. The upper is the flexor carpi ulnaris. Okay, flexor carpi ulnaris attaching to the aponeurosis, not onto the bone. And this aponeurosis is attached where? Onto the posterior border. It is attached. Then in the intermediate part, it is the extensor carpi ulnaris. So see this, one is flexor carpi ulnaris and this is the extensor carpi ulnaris. One is flexor, another is extensor. So naturally they are taking origin from this aponeurosis from opposite surfaces. And then there is a flexor digitorum profundus. Then the third muscle here which takes origin is the from the aponeurosis is the flexor digitorum profundus. Okay, so these are the muscles which takes origin from the posterior border which gives attachment to the aponeurosis. Okay. Now, let us go to the lower end, and in the lower end you have seen that two structures are present, and it is the head of the ulna, very small, and then posteromedially placed this small structure is the stellate process. Now articular surface is present only on anterolateral direction, and this articulates with that of the notch of the radius, ulnar notch on the radius, and then forms the inferior radio-ulnar joint. Okay, and here onto the undersurface of the head it is the rough, and this rough area gives attachment to the triangular articular disc, okay, the apex of which is attached to the base of this stellate process. Now this triangular articular disc separate the joint, that means the lower end of the ulna from the wrist joint, okay, from wrist joint, right. Now if you will see the posterior aspect of this lower end, there is a groove between head and the stellate process, and this gives passage to the extensor carpi ulnaris tendon. Okay, we have seen the origin of this extensor carpi ulnaris tendon, which will go there. Now coming very quickly to ligament, many of which I have covered here. Now there is the attachment of the ulnar collateral ligament. Okay, ulnar collateral ligament is attached onto the upper end of the ulna, and this is having the three bands, posterior, anterior and oblique band. Let me draw, I think, this band so that you can understand. See, for example, this is the olecranon process and this is the coronoid process. Okay, so if I draw the olecranon process, the beak-like structure here like this is the olecranon, this is the coronoid process, and if I fit the medial epicondyle of the humerus here, and this is somewhere the very rough drawing, the trochlea is here of the humerus, and this is the olecranon fossa and this is the humerus. Then this ligaments, okay, which is called as the ulnar collateral ligament. It has three bands. An anterior band starts from the medial epicondyle and spreads onto the coronoid process. So this is the anterior band of the ulnar collateral ligament. Another band goes posteriorly, and this is called as, which goes to the olecranon process. This was going to the coronoid anterior band. So this is the anterior band of the ulnar collateral ligament. This is the posterior band of the ulnar collateral ligament going to the olecranon process. And then there is the presence of an oblique band here. And this oblique band is present like this. This is the, in between the anterior and posterior band is the oblique. So this completely covers the, I mean to say, upper end of the ulna from the medial aspect. So we are seeing it from the medial aspect. So this is ulna, as I said, this is the humerus. Okay, so this is how the three bands of the, I mean to say, these are attached here. Let us come to another ligament here, what is called as annular. And I have already told you about the anterior and posterior band of the annular ligament. And then there is a medial ligament of the wrist, and this is attached to the tip of the stellate process at lower end. Okay, and this is called as the medial ligament of the wrist joint. And lastly, I had told you already, there is a intraosseous fibrous membrane attached to the sharp margin in its lower two-thirds. It is absent in upper part. Okay, it is absent. Now coming to the say for example the ossification. Okay, so I will just draw a rough diagram for ossification here. Say this is the olecranon process, the coronoid process, the body, and then this is the medial, I mean say lower end of the head and stellate process. Now the bone ulna ossifies in the cartilage. Whole thing is cartilaginous model. Okay, and when the 8th week of intrauterine appears, I mean say approaches, and during that week there appears the primary center in the 8th week of intrauterine life. So this cartilage started being replaced by this ossification center. So the bone starts gradually forming towards the lower end and towards the upper end, including the part of the whole of the coronoid process, part of the olecranon process, right? And then the birth will take place. By this time it is boning, and if you will take an X-ray in the last trimester of the pregnancy of the fetus, okay, in the womb of the mother, nobody takes the X-ray these days, okay, it is sonography which is taken. But in the olden days when X-ray were taken, you could have seen that the ulna is formed, okay, except its upper and lower end. Then after the birth, okay, then there will appear a center for ossification, okay, and this center for ossification first will appear in the 5th year of childhood, when the child is of 5 years old. Then secondary center will appear for lower end, and then this will form bone called as epiphysis. And the primary center will form the diaphysis, this will form the epiphysis. And then there will be another center, secondary center will appear on the 10th year of the life. See, let me bring it down. Yes, this is the 10th year of the life, and this is for in the olecranon process. And the bone, a small part of the bone will form on the top of the olecranon process by epiphysis. Now, then the fusion between epiphysis and diaphysis will take place, and this is around 16th year, okay, while the lower diaphysis and epiphysis will fuse around 18 years of age, okay. So which is the growing end of the ulna? It is the center, lower primary center, which appeared in the 5th year and joined on the 18th year. Okay, so it was first to appear and last to join as compared to the upper end. So the lower end of the ulna is the growing end of the ulna. Attachment of these muscles, some of these muscles through this atlas. This is Theme Atlas of Anatomy, which I acknowledge with thanks the use of this atlas to show you the muscle. Let us see this muscle here, which are attached onto the ulna. Okay, you can see this extensive muscle attachment which I was describing you again and again. This is that flexor digitorum profundus, and this is taking origin right from that of the olecranon process to that of the whole of the anterior shaft, the upper 2/3, not the whole of the anterior, but the upper 2/3 of the anterior and the medial surface of the ulna. Now, this was partly also taking origin from the intraosseous membrane, and then this muscle goes down, crossing the wrist joint deep to the flexor retinaculum, and divide it into the 4 different tendons, okay, for the index finger, middle finger, ring finger, and that of the little finger. Now, after seeing this, you can also see this muscle which is here. Okay, this is the pronator quadratus, which takes origin from an oblique ridge onto the lower end of the ulna, and then fiber goes towards the radius side. Okay, so this is pronator quadratus. Let us go to the remaining 3 muscles which I want to show you here. Let us see these 3 muscles which takes origin from the posterior aspect of the ulna, and then these muscles are abductor pollicis longus. See the upper muscle, upper 1/4 of the shaft below this attachment of the supinator muscle here. Then the intermediate muscle from the intermediate 1/4 was extensor pollicis longus. So this was abductor pollicis longus, this is extensor pollicis longus, which will go little by moving to the medial side, and then will go to the thumb. In between these 2 muscles, okay, you can see and another muscle here which is taking origin. It is the extensor pollicis brevis, okay, extensor pollicis brevis, right. So this extensor pollicis brevis was from the radius, but if you will see this muscle, it is hidden between the abductor pollicis longus and the extensor pollicis longus. So extensor pollicis longus, then below that is the muscle called as the extensor endicis. So in a line, there are 3 muscles, Okay, abductor pollicis longus, extensor pollicis longus, and extensor indicis. And from the supinator crest, this is the origin of the supinator muscle. First it goes towards the posterior aspect, then medial aspect of the radius, and then it will wind round to attach on to the anterior surface of the radius. So this is the supinator muscle, which is taking origin from the supinator crest and going towards the radius to be inserted. Okay, so these were the muscle. Thank you very much.